how is lepto typically diagnosed? I had trouble finding this. I just tried to do some quick
Yeah.
internet searches and it just seems like everybody does something different. So I'm curious to hear what how you are able to diagnose this.
Mhm. So there are basically three methodologies that we use to diagnose. The gold standard, sort of standard of care, is CSF cytology. So as I mentioned, this is lepto is cancer cells in that fluid. So we sample that fluid via typically a lumbar puncture. You sample that fluid and you look at it under a microscope to see, are there cancer cells present? So that's CSF, cerebrospinal fluid cytology. That is the sort of textbook answer. But ancillary to that, providing support, are things like imaging, so MRI of your brain and your spinal cord, as well as clinical symptoms. So it's all three together right now that are guiding our diagnostics: CSF cytology being sort of number one, and then MRIs and clinical symptoms. And that three kind of trilogy together is what we use for the diagnostics. I will say that as a field, we know that there are shortcomings to those diagnostics. And we are trying to look at the next generation, and we're beyond just improving upon treatments, we really want to improve upon diagnostics. That'll help us so many-fold, right? It will help us, of course, diagnose sooner, better, earlier. It will help us follow patients along their treatment courses better. And it really can revolutionize how we design and plan clinical trials if we have a better foundational understanding of our diagnostics. So there is how we currently do it, which is important to know, but also how we plan to improve upon those diagnostics, because there are challenges to our current diagnostic paradigm.
Absolutely, but I like that there's three different modalities by which you can really make a diagnosis. And I wanted to ask this because I think I've heard this from other doctors. Do you only need one lumbar puncture to prove, like if you get a negative result, do you recommend doing more than one lumbar puncture, or is one really sufficient?
So it's a great question, and the answer would be dependent on the situation. So the reason why people say that is because the sensitivity of a lumbar puncture and CSF cytology is not that great with one lumbar puncture. So depending again on what you read, it could be 50 to 60, 66%. So that means that a third of the time plus, we might be missing a positive result. So we might have a false negative. That sensitivity increases with subsequent lumbar puncture. So after lumbar puncture number 2, you might be up to like 70, 80%. And then maybe with 3, maybe 85, 90, depending on which paper you're reading. But we never really get past that 90% even after 3 lumbar punctures. But the reason why my answer to you isn't yes, do a second one, is because it's very situationally dependent. If I have a patient who I have a negative CSF cytology, but I have clear symptoms and clear MRI imaging, I might sit down with that patient and decide, it's not going to impact how we manage your care. And I don't need to necessarily, have you go through another lumbar puncture. Let's go this way. Versus if there was nothing on the MRI and, we were really still on the fence and it was going to impact further care. And then I might suggest in that situation that, hey, we need more data to stand on solid footing with our treatment decisions. Then I might say, yes, let's proceed with another lumbar puncture. So it's really, the whole patient, keeping kind of the whole patient in mind.
Yeah, and that I think as metastatic patients, we're kind of used to this. It depends answer. It's like it really does depend on the situation. It depends on many different factors. But I just wanted to ask if there was a straightforward answer. And I think what we're learning with leptomeningeal disease is that there really aren't a lot of straightforward answers. And we're going to get to the research that's been ongoing.